An all-on-4 is probably the closest thing we can get to natural teeth. We need a minimum of 4 implants and we can screw a bridge in there. A normal overdenture is still about the same size as a denture, but it can be removed and snapped on. These though have to rely on your gums for stability. The implants help it keep it in, where the fixed is the implants are holding it in place. If I told you I was going to build you a fence, but I wasn't going to put any fence posts in the ground, that fence would be pretty unstable. Implants are the fence posts for our fence, which allow you to function like real teeth. We'll do the initial consultation with either Dr. Queck or myself, get an x-ray done and what we call a CBCT, so that we can look at your skull in 3D space, plan the implants. Then we have you in for surgery, extract teeth, or just place implants. And you'll go home that day with a 3D printed temporary that is screwed into the implants. So the recovery time for an all-on-4 can really vary depending on each patient. No matter what, the implants do take between 4 to 6 months for the bone to grow on before we can do the final restoration. But if you decide to do the immediate load, we're able to, have screwed in teeth during that time, or we can do a delayed load where you're wearing a denture, and then in the 4 to 6 months, we screw in the final prosthesis. Definitely now with the technology that we're able to utilize with digital planning, most of the time it's a high 90 percentile or 95 percentile success rate. Again, you can't always guarantee what the human body is going to do, but using the right technology and the right techniques, we're able to maximize success. Usually when it comes to the package, is Dr. Queck's fee is separate than mine. You would pay for the surgery day of surgery. My payments is pay the deposit once we start, and then over those 4 to 6 months, you make payments until when we insert the final prosthesis. We do have a financing company if that's something you're interested in looking at. So there's definitely different options that we can go down.